Hello guys, again welcome back to my channel. So I am Rohit from Certified Professional Coder and Registered Pharmacist. So in this video I will discuss musculoskeletal system coding guidelines. So don't skip the video. Let's start it. Musculoskeletal system is divided by anatomical site like head, neck, back. These are under sections are based on procedure like incision, excision, manipulation, repair, fracture, amputation. Then incision means a surgical cut. Then it is important point. Then excision means removing or removal. Then manipulation means reduction. Then removal, repair, reconstruction means arthrography, arthroplasty. Then fracture, dislocation means surgical fixation. Then amputation means surgical cut, not only cut, surgical cut. Then next point, wound exploration. Code range between 201002 to 20103. Then this code described by surgical exploration and enlargement of the wound. Then extension of dislocation, debridement and foreign body removal. Then ligation and coagulation of minor blood vessels. Then this code are cover both exploration and repair of the areas. Then in this point you can read carefully it code description, that is 4 points. Then next point, arthrocentesis, aspiration, injection of joint or bursa. Code range between 206002 to 20611, and these code are based on size of joint or ultrasound guidance utilized or not utilized. Then its example, arthrocentesis of right knee with an aspiration of right knee bursa should be coded with only one unit, that is 20610 or 20611, not coded with both coded separately. Then if the procedure are performed more than one joint, then code both separately. And one point, injection of substance doesn't include in drug, so the drug should be billed separately with HIPICS part 2 code. Then next point, joint injection 27096 including guidance code. If CT or fluoroscopic imaging is used, then code 27096. And if CT means CT scan, if CT scan or fluoroscopic imaging is not used, then code 20552. And bilateral scalar joint injection, then append modifier 50 with the CPT code. Then next point, replantation, that is 208022 to 20838. These codes are mostly used in anatomical location with complete amputation, and for incomplete amputation repair, so assign code with modifier 52. So this is guideline is important. Next point is bone grafting. So what is bone grafting? So who want to know bone grafting? So please comment me, I will check it. Then bone grafting. Bone graft is needed to create environment for a solid bridge to form. If allow a new bone formation to fuse the section of the spine together. There are two types of bone graft, autograft and allograft. Autograft means one side to another side of same individual graft, and allograft means graft from a donor of the same species, sometimes from cadaver. Then bone grafting important guideline. These are procedures are reported separately in additional code with Arthodesis, but don't use modifier 62 along with bone graft code 20930 to 20938. And like similarly, instrumentation is also reported separately in additional with Arthodesis, but don't use modifier 62 along with definition or add-on of spinal instrumentation process code 22840 to 22848, 22850, 22852, 22853, 22854, 22859. And don't be use modifier 62 along with this. Then next point, that is arthrodesis for the spinal deformity, keratosis or kyphosis. Code are based on approach vertebral segment like posterior, anterior, Postural code range between 228002 22804 and anterior code range between 22808 to 22812. Next is its example. So you can solve example and who want to need like CPT series wise examples like anesthesia, musculoskeletal, cardiovascular. All CPT series questions are available. So who want to need, WhatsApp me. So I will share you CPT All Series question plus CPC exam preparation notes. So any query regarding any question, then comment me. Thank you all of you.